This is Panteha Rezaeian, one of the family physicians. Here we are so glad to present another Miracle of Living lecture. And today we are proudly have a presentation about the caregiver stress and how to cope and achieve the happiness. So our first speaker is Dr. Moe Gelbart. He is a director of behavioral health. He is the PhD and licensed clinical psychologist and a graduate of University of Southern California. And he has practicing since 1976. He has expertise in alcohol and substance abuse, and he is actually certified by American Psychological Association in the treatment of the substance abuse, and he is one of the founders of the Thelma Macmillan Recovery Center and is executive director of the center. Actually, it has been a very great program. I personally sending many of my patients to Dr. Gelbart. So he's presently a director of behavioral health at the Torrance Memorial Center and the director of employee assistance program. Dr. Gelbart has consulted the California Medical Board diversion program and California State of Lawyers assistant program. He has a wide experience in the chronic pain and workplace violence and stress management care issue. And he has been working with the adolescents, adults, and individual couples and group therapy. In addition, Dr. Gelbart is treat anxiety, depression disorder, and relationship. Please. Perfect. I'm sorry, Dr. Dennis. I was thinking Dr. Gelbart is going to be. Dr. Fred Dennis, he is an emergency physician by training and currently medical director of Torrance Memorial IPA. Dr. Dennis trained in Canada, first at the University of Toronto for his medical degree, and then McGill University in Montreal for emergency medicine. For those who know, definitely McGill is one of the best universities in Northern California, in Northern America, sorry. After a very cold Montreal winter, he immigrated to Los Angeles with his wife and practiced in the various emergency departments, including Cedars-Sinai for 10 years. While at Cedars-Sinai, he started an executive practice to help people make a better lifestyle decision. During this time, he developed his 7 pillars of longevity while incorporate optimal approaches to living a productive, independent, enjoyable life as we age. Dr. Dennis, please come here, and we are happy to hear from you. Thank you.
Thank you very much. First, the disclaimer that these opinions are my own, and I expect Dr. Gelbart probably the same. They don't represent necessarily opinions of TMMC or Torrance Memorial IPA. So, stress. Are you under stress? I sure am. I think everyone is under stress, and caring for the caregiver is a fabulous topic because we're all caregivers. We're all caregivers to others, but we're all caregivers, first of all, to ourselves. I was just up in Canada a while back, and the pre-flight announcement reminded me that when the plane depressurizes, which I hope it never does, that you should put your own oxygen mask on first. And so that is the theme of what I'm going to be talking about, which is putting on your own oxygen mask first. Now, that doesn't mean that whoever you're caring for doesn't need oxygen too. But everything that I say hopefully will also apply to the people you're caring for, whether it's caring for your parents, caring for your children, caring for a spouse or a partner. one thing that I've noticed is that there's tremendous increase in the amount of stress. And why are people having trouble coping? Well, it's called amygdala hijack, and I'll explain that in a moment. But here's just a graphic way of looking at it. I call it my red line theory. So red line is where the level you can't cope anymore, where all of a sudden you lose control. We've all been there, where all of a sudden you can't process information, you just get into a rage, or you get scared and you run. So the little graphic representation is, on the left is a tiny bonfire, and that bonfire represents where we were before COVID. So there was quite a lot of difference between the bonfire and our red line. So maybe 80% of the stress level. So we had some room to move. But now on the right side, that's where we are with COVID. We're at 95%. And so that's why on the freeway, when somebody cuts you off, it's really hard to retain your composure. I'm going to turn this to Dr. Gelbart for a second.
Thank you. Oops. Good evening, one second. Good evening, everybody. We're just going to go back and forth a little bit, so hopefully it's not too confusing for you. So thank you to Torrance Memorial for this opportunity, and thank you all for attending tonight. You know, I'm excited to be here, especially with my colleague and very good friend, Dr. Dennis. We've given similar talks many times before, and again, it's an honor for me to be on the podium with him. So I've been a psychologist, as was said, in this community for 45 years, and director of behavioral health at the hospital and director of the Phil McMillan Center. As Dr. Dennis said, you know, somewhere to someone, we're all caregivers. And, you know, the responsibility of taking care of someone can be rewarding, but at the same time, it can also be overwhelming. Being willing to, you know, the first step is being willing to acknowledge that reality, and that reality, that it could be overwhelming, that you don't have to be perfect at what you're doing, and not attacking or judging yourself for perceived lackings. That's really important, is to be able to say, look, I'm going to do the best I can at this. And part of what we're going to go over in a little bit is ways in which to improve that mood that you have and that ability to take care of yourself. So let me just go over a little, and I'll turn it back to Dr. Dennis. Some signs of caregiver stress, and I think this could be signs of many kinds of stress, but feeling overwhelmed and constantly worried, feeling fatigued. You know, somebody very close to me has gone through this for the last year, by the way, taking care of someone who wound up being disabled, and the impact is 24/7. I mean, the intensity with which the person I know had to go through this has just been phenomenally difficult and to bear. So as I say, feeling fatigued, too much sleep, not enough sleep, becoming easily angry or irritated, feeling sad or depressed, frequent physical symptoms like headaches, stomach aches, back pain. You know, if you're not dealing with your emotions, which I'm going to get into in my part of the talk in a moment, then your body will tell the truth. Your body will begin speaking your feelings through symptoms that it will go through. Losing interest in activities you enjoyed and feeling hopeless at times. So if you're feeling some of this, you may have what's called caregiver stress syndrome. And again, realizing and owning it is the first step in improving it. And we're going to provide some very practical things to make you feel better, to make life somewhat easier. And for me, and I'm going to turn it over to Dr. Dennis, the most important thing whenever I give a talk, I want you to be able to go home with one or two things that you will try and that will work for you. Hopefully more, but if you go away with one thing that says, I'm going to try that, then I've done my job. So with that, let me turn it back to Dr. Dennis.
Thanks, Dr. Gelbart. I promised that I would talk about briefly amygdala hijack. The amygdala is a sorting center in your brain. And early on, probably in our evolutionary stage, we had that reptilian brain, which is basically fighting or running away, fight or flight. We developed our frontal lobes to think and process intellectually. But what happens when you get under stress is that amygdala, instead of sending the signals to your frontal lobe so you can think, routes it back to the reptilian brain, and we want to fight. And I believe that anger is just fear turned outward. And what happens is people become angry because they want to push that threatening object away. One thing that has been in the media a lot is talking about the Great Resignation. Typically, all of the studies that I see say that at any given moment, 40% of the people who are working are thinking that they probably want or are considerably motivated to be looking for another job. But I think that actually people are taking a look at their lives in a larger sense. And I call it the Great Revise, which is everyone is looking, I believe, at not just are they working where they want to be, are they working as much as they want to be, are they working for the boss that they want to be working for, but they're also looking at other aspects of their life. If you're lucky enough to be working remotely, are you living in the place where you can be effective and efficient? If you've got a couple who are both working from home as well as looking after kids, is there enough room that one of you is on the kitchen table and the other is in the bedroom, and you're both trying to be on Zoom calls and the kids are running around? So people are looking for bigger places. They're looking often for remote places. And this is good. I think that this is excellent, actually, this Great Revise, where we're looking at our lives. Change theory, as taught in business school, says that you need to have a crisis before you can thaw your belief systems. And we're all going through crises, and I think we're thawing some of our beliefs that we needed to be this, we needed to do that, we needed to live here. Sometimes it's intruding into relationships, though, and people are taking a look and saying, am I with the right partner? And that's honest, that's real, and that's necessary. But I caution you with those two things especially, looking at your job and looking at your partner. You should try to, if you're not happy and you're not comfortable in that environment, you should be dissecting what it is that you're not comfortable with, and can you find it? Have you sought it out? If it's a job, and it's typically, as the axiom goes, people don't quit jobs, they quit their boss. Is it your boss that's getting on your nerves? Well, maybe you can work for the same company in the same setting, but work in a different location where you have a different boss, because it is very disruptive to change jobs. And there's no question about that. And perhaps, if anything, more disruptive often to change partners. So what I'm going to advise you is to start thinking in that direction as a positive force for change and for improving your life. So 7 pillars of longevity. When I was at Cedars and I set up my executive coaching business, I wanted it to be based on some hard facts. I'm a doctor, I'm a scientist, I believe in studies that have significant power, enough people, and rigorous. And I started coming across all sorts of different ideas on how to improve your life so that you lived independently. Longevity to me does not mean living 120 years. If it means that I'm totally dependent on other people for everything, I'm not mobile, I can't feed myself, I can't wash myself, that's not, to me, where we want to be. I don't think anyone wants that kind of dependent life. They want an independent life. So I started looking for items in various journals, and I continue to do that. I take a look at 20, 30, 40 journals a month to look for ideas that will allow us to be independent as we age. And I found that they sorted themselves into about 7 pillars. So those are my 7 pillars of longevity, and we'll just touch briefly on them. This portion of the talk is actually something that I've tried to condense down for 2 hours into 10 minutes or 12 minutes. So optimal medical is the starting point. I'm a physician, and I always start from optimal medical. We're like very complex computers with multiple programs, 10, 15,000 different programs. At any given time, maybe 500 are activated. And you can activate those by what you eat, what your exercise, what you're thinking, your thoughts. And so you can turn on the good programs and turn off the bad ones. Well, what are the programs that are running? The programs are running are the ones that you're genetically programmed to do. So you are programmed for the diseases that your parents have, that your siblings have. And if you take a history yourself of what's going on in your family, you'll find out where your risk factors are. For me, for instance, my mother died of her second heart attack in her early 50s. And that happened when I was in medical school. So I have been very concerned about heart disease and my risk of heart disease. So I personally look out for things that are going to accelerate the risk of heart disease. Blood pressure is one of them. By optimal, I mean, though, not necessarily what's published out there, but maybe what's in the research. And so optimal blood pressure is not 120/80, like the American Heart Association says. If you look at the studies in terms of where the sweet spot is for blood pressure, it's closer to 110/65. Now, I can't get there naturally. So what I do is I take 2 different types of blood pressure medication to drive my blood pressure down to that optimal level. The same thing happens with cholesterol. My bad cholesterol was too high for optimal heart protection. So I take a high potency statin to drive that down so that my LDL is below 60. So again, what's optimal for you is what is going to prevent you from getting the diseases that your family have. Optimal diet. Well, there's probably no more controversy over anything than diet, exercise, and supplements. But I think that everyone who's involved in the dietary world believes that the DASH diet or Mediterranean diet, very similar, are ones that are probably optimal for most people. Now, I'm not saying that being a vegetarian is not superior, but it requires more work to make sure that you get your micronutrients and your protein. We know what's bad for you. What's bad for you is sugar-sweetened beverages. You shouldn't be drinking your calories. We know that too much mammal meat, meaning beef, pork, is not good for you. Your protein sources should be towards a vegetarian, towards beans, legumes, nuts. Chicken and fish, of course, are good. And of course, dark chocolate. I am a huge fan of dark chocolate. If there's one addiction that I admit to willingly, it's the fact that I have to have dark chocolate after every meal. That's definitely good for you. The other dietary point I want to talk about, and I don't have enough time to get into this in too much detail, but I'm a huge fan of intermittent fasting. Intermittent fasting simply means that you restrict your time that you're eating to a small interval. So intermittent fasting for one day means that you choose a 4 or 6 hour window, and during that time, that's only when you're going to eat, and the rest of the time you don't. Or in my case, I like at least once a month to do a 2 or 3 day fast, and that's a clear liquid fast. Okay, coffee, tea, water, non-sugar sweetened beverages, and it does marvelous things for your metabolism. It lowers your fasting insulin level, lowers your blood sugar, lowers your blood pressure, lowers your bad cholesterol, and most importantly, it lowers the amount of inflammatory chemicals in your body. Inflammation is a common pathway, or sits at a very central sorting spot for almost all the chronic diseases. Heart disease, cancer, diabetes, arthritis, all of those are significantly influenced by inflammation. So you reduce the amount of inflammation in your system when you're on a fast. Optimal supplements. I'm just going to touch briefly on this. This is very controversial. A lot of people don't believe in it. The standard medical community is kind of, I don't know about it. But I am a firm believer in appropriate supplements. For instance, since I take statins, I take coenzyme Q because statins prevent the coenzyme Q from being regenerated in your body, and coenzyme Q, low levels are related to things like muscle cramps that people get with statins. But also, it's been shown that your cardiac output drops if your coenzyme Q level is too low. So you need to be thinking in terms of balancing off sometimes some of your risk factors. Curcumin, for instance, is another one that I'm a fan of if there's a history of cancer in your family. There's some pretty good evidence, and in fact, there's some government studies looking at curcumin as an adjunct to cancer and preventing cancer. And then finally, vitamin D. Even though vitamin D is not considered by the U.S. Preventative Task Force as to be that important, they should be testing for it. I firmly believe you should be getting a vitamin D level checked when you go and see your doctor, and it should be above 50. Optimal exercise. We all know that you should be getting aerobic exercise. You should be working with some weights, especially if you're a woman, because what you want to do is you want to put some weight on your spine so that if you're doing upper body weights, you're putting weight on your spine, and that's helping to prevent the osteoporosis that tends to happen when you lose your hormones, your natural hormones. And then finally, coordination and balance. Falls are a big killer among older people. And coordination and balance is a training thing that your brain does, right? It incorporates inputs from your eyes, from the balance organs in your ears, from the little proprioceptors, the little nerve impulses in your joints and your muscles, and tells you when you're falling to one side or not. And if you do things which put you off balance, like riding a bicycle or doing Tai Chi or walking on uneven ground, that helps to keep your body ready so that if you again trip on something, you don't go into a face plant, because that can be very dangerous. Optimal financial planning. This was one I hadn't thought about until I had an elderly patient come in to me in the emergency department at Encino from Jewish Home for the Aging, which is the largest collection of 90-year-olds on the planet. And she was not very happy because, as it turns out, she wasn't really there because she thought she was having a heart attack. She was there because she was depressed, because she was running out of money. Her husband hadn't, and she hadn't planned on them living too long. And she said, I can't imagine what would happen if I ran out of money I'm 83 and my burn rate is high enough, and she used the term burn rate, so I know she'd been thinking about that. My burn rate is high enough that I'm going to run out of money before I get to be 90. And she said, I can't imagine what it would be like to be living on the street and to be 90 years old. And so I use that all the time. You're not going to make it to 90 unless you are financially able to get there. So don't run out of money at 80 because you won't make it to 90. I'm lucky in that we got a financial planner early on who convinced me to just take some money out of my paycheck every month and put it into the bank, and I'd never see it. And also to make sure that I'm not taking stock tips and current with stock tips, it's crypto, right? We're seeing how that's working out badly for people. If you don't have the time and the energy to be saving, to be working with a financial planner, my advice, Anthony Robbins put out a whole book about this, but the key point is, if you're not really going to take the time and the energy to be a wise investor, put your money into low-load indexed mutual funds. Low-load means that the company, like Fidelity or whoever's offering them, just takes a tiny slice off every year of your savings to manage the fund. Index means it's indexed to some sort of financial indicator, like the S&P 500 or Dow Jones or whatever it is. And if you take a look on your iPhone, there's a stock app. And if you look at the stock app over the history of the stock market, you see that it's a pretty straight line. It goes very nicely up. Now, right now it's doing a lot of this up and down, but it's still moving in the right direction. And so it's a generally a very historically safe investment. And then finally, optimal stress reduction. 30 years in the pit, which is what we call working in the emergency department among emergency docs, the pit. I had to learn how to deal with stress on an acute basis and a chronic basis. Acutely, it may be something like I would have a traumatic full arrest come in, and those are gut-wrenching. And the next patient may be a 2-year-old with an earache, and I can't bring that stress that I felt during the resuscitation into the room with that child. That's not fair to them, and it's not fair to me because I can't think properly, amygdala hijack, right? So I had to learn how to de-stress very quickly. And 2 techniques that were really valuable for me were one breath, which is essentially taking a slow breath in and then slowly breathing it out. And during that time, using your senses to think of, and feel what's going on around you. It can be if you're sitting in a chair, what does the chair feel like on your bottom? What sounds are you hearing? What are you seeing with your eyes? In other words, get outside of your head. Stop that monkey chatter that is drawing you in and causing you stress. It's especially effective too if you can couple that with some visualization. So when was the last time that you were really happy? Was it when you played with your daughter? Was it when you took the dogs for a walk? Was it when you went on a vacation and you saw that great sunset? If you can visualize that, again, it gets you out from inside your head and lowers your blood pressure, your heart rate, and your stress chemicals almost instantaneously. So this is where I turn things over to my colleague, Dr. Gelbart. Your turn.
That was great. Thank you. So we're going to look at the my area of work, which has to do with emotions and feelings and basically just learning how to feel better about things. Let me start with a word about the business of psychology, or not the business, but the science of psychology. It's relatively new. It's only about 150 to 175 years old. It was originally, psychology was developed when people were really suffering. They were severely depressed, severely anxious, and the goal of psychology for most of its history was to take these, poor people and get them to be somewhat close to functioning. But the last 25 years, we have kind of a revolution in psychology and psychiatry, and that is what we call the science of positive psychology. We now know how to take people who are not depressed necessarily and who are not feeling well, and how to get them to function better, and how to feel better, and how to feel more happier about things. And studies have shown us the factors that make people happy, and I'm going to share some of those with you today, okay? Because that's the plan here. And these are all characteristics of gaining a well-functioning life and a happy mind and a feeling positive about one's life. But most important maybe is feeling in control of things that maybe right now you feel out of control of. So what are some coping mechanisms for dealing with the emotional aspects of caregiving? Let's see if we got this. One, the importance of living in the moment, or living one day at a time. We've seen, especially in the last few years, I promised myself for the most part I'm not going to say the dreaded word COVID, but I may have to refer to it once or twice during this talk. But we've seen how unpredictable and fragile life can be, and we know that nothing's guaranteed. And although we could be powerful and wealthy and feel in control, much of our lives are not really in our control. Now, this may sound depressing at first, but actually it's a positive message. What we have to understand is there are things we can control and things we can't control, and we need to focus on those things that are in our control. I'm going to get to that in just a moment. But that helps us empower us, and as I said, we need to learn to live in the moment. We need to learn to live today. So if you're depressed, you're living in the past. If you're anxious, you're living in the future. And if you're at peace, you're living in the present. And maybe another way to look at that is plan like you'll live forever, but live like you will die tomorrow. And again, that sounds, I don't mean to sound depressing, but it just means that, it doesn't mean like one day at a time, like we don't worry at all about the future. We plan for the future, many of the things that Dr. Dennis was talking about. But we need to live our days today like you will not live tomorrow. And again, rather than see that as a depressing thought, that's actually, in some ways, if you can see it, uplifting. So a principle for increasing and achieving less stress is to live in the present. Another coping mechanism, building resilience. So what is resilience? It's the ability to adapt to stress, trauma, difficulties, and to handle those difficulties well. As I said, I promise I'm not going to spend much time on COVID, but I may have to point to it once or twice. And, 2.5, 3 years ago, we were asked, could we handle our society closing down? Could we handle 1 million people dying of a disease? Could we handle schools closed for years? Many of us would be like, no way. But you know what? We've experienced, we've seen that we were able to get through this. And that is resilience. And the other great thing about resilience is you're not born with resilience. Resilience is a skill you can learn. It's a skill that can be taught. So if any of you hear some of this, don't feel like, oh gosh, too late for me. You can learn to become more resilient at any time. And what does resilience look like? So resilient people are self-reliant. They can take care of themselves. They're independent and optimistic. They have high self-esteem, high sense of confidence. They know, this is an important one, they can grow from their mistakes. I don't even like to use the word mistakes. I like to use the word successive approximations to the goal, because mistakes really inform you of what one should do. For example, if you're shooting a bow and arrow and you miss and it goes off to the left, that's a message that says, move over 2 feet to the right. So again, resilient people don't get down on themselves when they make mistakes, so to speak. They're problem solvers. They're not perfectionists. And by the way, especially in this caregiver stress syndrome, perfection is the enemy of good. If you think you need to be perfect, if you think you need to get everything right, and if you are down on yourself because sometimes things don't work out right, remember, you don't need to be a perfectionist. And then the last part is understanding happiness. So with that knowledge, we can address future stress with confidence that we can get through it and that we can handle it. Another important part of resilience is learning not to catastrophize. This slide says, what is rather than what if. I spend a lot of time with people in my practice and my work, teaching them how to change one letter in their stressful life. And that one letter is changing an F to an S. Instead of what if, what is. Because what if is catastrophizing. What if means when our mind is thinking about things that could happen, we have high functioning brains that work really well, but as a result of those high functioning brains, we can imagine all kinds of scenarios. Like we were talking earlier about recent shooting the recent thought that there was a shooting in Las Vegas. So they heard a noise and then they say, well, what if that's a shooter? Well, what if I'm in the wrong place? And before you know it, there's this whole cascade of catastrophizing. So I tell people, take a breath. If you're into the what if, take a breath. Like Dr. Dennis said, breathe in, careful, yell in your head, stop, and then say, what is? What is means what is happening in the present. The beauty of what is that what is something you can do something about. What is informs you about what's in your life at this moment, and again, is something you can do something about. What if we can't do anything about but create ongoing future catastrophe? So really important to stop catastrophizing, and this is part of staying in the present and dealing with what is rather than what if. Similar to this, another piece of that, is control the things you can control and let go of the things you can't control. Again, in my practice of psychology and psychotherapy, so many people are coming in suffering from trying to control things they have no control over. And again, and what do we have control over? If we look at this slide, the things I can't control, I can't really read it carefully, but it's basically I can't control the behaviors of other people. I can't control what other people will do or what the world will do. What can I control? I can control my own behavior. And, I'm the director of the Drug and Alcohol Treatment Center at the hospital, Phil McMillan Center. We have this, in AA, they have the serenity prayer, which is, let me control the things I can control, let go of the things I have no control, and have the wisdom to know the difference between them. And again, many people come into my office suffering from trying to control things they can't control. And there's a certain empowering feeling, again, when I ask them, take a few breaths, think about the situation you feel really stressed about, and if it's one of these caregiver situations, and ask yourself, most likely in these caregiver situations, you're probably involved in many of these things I'm talking about. You're probably what-ifing yourself to death. What if this happens to my loved one? And if that happens, what if this happens? And again, if you say what is, it turns into what am I dealing with today? Same thing when you start feeling like trying to control things that are not in your control. And again, take a breath and say to yourself, what part of this problem, what part of this difficulty do I have control over? And let me exercise that control. And it makes a world of difference in how somebody feels. So the principle that we're resilient, need to deal with what is, and control things we can lead to a healthy mind and less stress when caring for others. Again, an essential caregiver skill. We can't do this alone, okay? It's a mistake to try to keep everything inside and be all by yourself. Science has proven the importance of relationships. And the psychology of happiness studies correlate well-being and mental health with relationships. But they don't have to be a lot of, it's not the number of, it's not how many Facebook friends do you have, or how many Twitter followers, or whatever it is. That's about as far as my social media, skills go. But it's meaningful relationships. It's quality of relationships with people you can open up with and talk to and let them into your life and they let into theirs. We learned, again, through the pandemic, social distance doesn't have to mean social isolation. There's lots of ways to connect. And as I say, it doesn't have to be a lot of people in one's life, but relationships are essential. People who are suffering from stress, are depressed, are angry, are sad, when you keep that to yourself, it eats you alive. As Dr. Dennis alluded to, feelings like that kept inside turn into depression. Feelings like that are pushed out turn into anger. So unless you're dealing with those feelings and generally with someone else, it's going to have a major impact on you.
So, Moe, can I just add something here? There's a great TED Talk on relationships. And Harvard University, apparently back in the 30s, started studying people longitudinally to see what contributed to longevity. And long story short, what they found was relationships were the single most important thing, more important than anything that I talked about, diet, exercise, stress reduction, and the rest of it. It was relationships. Yep. So you absolutely are spot on that.
And thank you for that. And studies show relationship benefits, less stress in one's life, better healing from illness, healthier general lifestyle and behavior, greater sense of purpose, and as Dr. Dennis said, longer life. People in relationships live longer. So again, important part of living. If you start to feel sorry for yourself, it's important to keep things in perspective, okay? And you need to learn how to focus on gratitude. And studies indicate that those who practice gratitude are less depressed, less anxious, and happier. And again, like resilience, gratitude is something that can be fostered and worked on. And when we have stress, loss, and hardship, we begin to catastrophize. We think of the worst. and the way our feelings work is, our feelings are connected to our thinking. So when somebody says, I'm depressed, I'm sad, you can't say, or you can, but you really shouldn't. No, you're not. Okay? How one feels is always correct. But the feelings that one experiences always come from how one thinks. And so if we can help change how a person thinks, we will change how they feel. And not change as in manipulating, but change as in understanding better, or gaining new information, or gaining some explanation of something that they thought had occurred in their early life, but may have had a different source of problem. So again, when we're feeling these feelings, one of the ways we can begin to get out is reflect on the now and reflect on what's good in your life. And especially in this country, for the most of us, even as stressful as things are, you can go to Whole Foods and park 30 feet away and open the doors, and you have the greatest source of food in the world. A billion people go to bed hungry every night. They haven't eaten. And yet we have the kinds of lives that sometimes we have to reflect on. That's all I'm saying. And we can do that. And you can do that at any age. I have grandchildren, 3 and 6. Every night they go around the table and they talk about what do they have to be grateful for? What went on good in their life, as well as what were some of the thorns. They go what are the thorns and what are the rose petals, of the day. But that can be done at any age, is what I'm saying. And again, I told you when I started, I want you to go home with some things that will work for you. Do this for a month, and I guarantee you, when you see me on the street, you're going to feel better. Every night or every morning, one or the other, jot down or at least what 3 or 4 things you're grateful for. And they don't have to be big things. They don't have to be like, I won the lottery. It could be, like I said, my family is healthy today, or we had 3 meals and they were good, or somebody did something really nice to me yesterday. Again, if you begin thinking about it in your life, you're going to find tremendous things to be grateful about. And so practicing gratitude is something you can do. And again, as this slide says, we don't practice gratitude because we live happy lives. We live happy lives because we practice gratitude. So that's the flip on that. Also know as a caregiver that taking care of others is not only a gift to them, but it's actually a gift to yourself. Giving is another source of well-being and happiness. And research in positive psychology shows that caring and giving to others results in our happiness, okay? Even though it might be tough at sometimes, it results in us feeling accomplished and satisfied. And again, taking care of others can start at any age too. I'll use my grandchildren again. From as early on as they could understand, they are volunteering some of their time. Or, when they get gifts at holiday, half the gifts get taken, they choose and they give them away. And they they take into the shelters where they give them to kids who are not quite as fortunate as they are. So again, it could be done at any age. And again, research shows that giving to others produces less stress, less anxiety, less depression, more self-esteem, lower blood pressure, healthier lives in general. So giving connects with gratitude, and again, is something you can do. I'll go through this quick because Dr. Dennis spoke a lot about self-care in terms of your mind and your physical health and your sleep and your spiritual health. He's going to come up to in a moment. And, so basically taking care of yourself is essential. Sleeping is essential. I'll just touch on it for a moment. It's really important to get 7 to 8 hours of sleep a night. And there are techniques of sleep hygiene that don't involve medication, that involve, a few months ago at a talk similar to this, somebody gave this is another one of those clues you're going to take home with you. 4-7-8 breathing. And 4-7-8 breathing means you breathe in slowly, 4 counts, hold it for 7, and breathe out for 8 counts. As soon as I started that, within a few days, I always slept pretty good, but I slept 100% better. And I still do it now every night for months. So 4-7-8 breathing.
Can I add something here, Mo?
Yep.
30 years of working shift work as an emergency physician, I had to learn how to sleep in the day, the night, or the afternoon. Key things: you sleep best when it's dark, when it's cool, and when it's quiet. So make sure that you're not falling asleep in front of the TV or in front of your video games. Make sure that you have a cool, dark, quiet place to sleep.
Exactly. That's the part of the definition of sleep hygiene is controlling those. And with that, and much of what I've said, by the way, is the key to feeling good, the key to taking care of your stresses, the key to happiness, is the key to reducing your caregiver stress. A lot of this revolves around becoming intentional. Okay? These are not accidents that you feel better. There are things you can do, there are things you need to do, and you need to be the one who drives your ship, so to speak. Probably about a year ago, I saw a young 20-year-old on CNN. I think her name was Nightbird. She had terminal cancer. They didn't think she was going to live very long at all. She was a singer, and she was on America Got Talent first. I have never heard anybody so positive, and her songs were positive, and her message was positive. And as she said, you can't wait until life isn't hard anymore until you decide to be happy. So it's not waiting till then, it's grabbing it and knowing you have the ability to make a difference in your own life. So many of us go through life without a plan. I use the example of it's like getting into a sailboat. You get into a boat, put in the water, sit back and let the wind take you. Sometimes it takes you to a nice place, sunny place, sometimes it's stormy. But if you don't have a plan, if you don't have a mapped out plan, you're not going to get where you think you want to go. I tell people a lot that I work with, if you don't change direction, you're going to end up where you're heading. So think about that. If you don't change your direction, you're going to end up where you're heading. Or I tell them, you're always going to end up in the direction you're heading. And I can't tell you how many people come to see me, and I use this example. I say, if you want to go to San Diego, you can't head north on the 405. Okay? So if you want to get to San Diego, you got to go south. Because a lot of people say, I don't know, I'm not going where I want to go. Well, then make some changes in your life to get to where you think you want to get to. So again, it's about how we choose to perceive life. And it's as simple as the proverbial, this is the glass half empty versus glass half full. If we look at the glass half empty, we're going to feel down, sad, and so on. If we look at the glass half full, we're going to be up and happy and okay. But here's the beauty of that deal. The water in the glass doesn't have to change for you to see it differently. You follow? The water doesn't change. What changes is how you perceive something. And when you change how you perceive something, you change how you feel about it. I just like this slide because I'm not sure why, but it fits in somewhere. But it says, be with someone that makes you happy. And if you just cross out with, one word again, then it says, be someone that makes you happy. And again, that's that intentional part of what you can do for yourself. Just real quick, some things to manage stress as a caregiver. Some of this we've talked about already. Accept help. Don't do this on your own. Perfection is the enemy of good. In other words, be okay with yourself. Give yourself a break. Be realistic. Okay, sometimes you have to deal with, like I said, what you can control and not deal with things you can't control. And then finally, join a support group. Don't do this on your own again. So with that, I'm going to turn it back over to Dr. Dennis, and then I'll be back, I think, in a few moments.
Thanks, Mo. Those of you who are counting knows that we only touched on 6 pillars. We've got the 7th one still to come. And this is the most important one, and it really reinforces what Dr. Gelbart's been saying. My definition of spirituality can include organized religion, but I want to talk more about sort of the big enchilada. What's your relationship with the world, with yourself, with others? Starting with ourselves. Many of you in the audience, and certainly the two presenters, are type A and tend to be perfectionists. Physicians, I think, are selected for their desire to be perfectionistic. And that's what you want in your physician, is somebody who's going to try to do the best darn job. But the trouble is because you have these high expectations, you never meet them, or maybe meet them only occasionally. And then you beat yourself up because you're not perfect. Well, guess what, folks? None of us are perfect. And the only way to succeed all the time is to set the bar so low that you're not going to try anything new. And that's a drag. I mean, all of the good times in my life have been when I've met some sort of expectation. And all of the real learning that I've done is when I've tried to achieve something and I failed. I don't learn from success, I learn from failure. So you need to try to extend your horizons and take chances. But when you don't succeed, Edison was said to have tried 10,000 experiments that didn't work. And when a reporter asked him about that, said, how does it feel to fail 10,000 times? He said, no, each time I came closer to succeeding. And that's my feeling about beating myself up, is that I need to cut myself some slack. You need to cut yourself some slack. You need to stop beating yourself up. Peace with others. All of us tend to have some, I won't call them friends, some acquaintances that don't make you feel good. People that are not positive forces in your life. They may be positive forces in somebody else's life, but they're not in yours. And what you want to do is you want to surround yourself with people who make you feel good, who reinforce you, who challenge you, who give you honest feedback. And they don't have to be people who are continually saying yes, 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 yes. They can be people who are holding up a mirror to you in an honest fashion, but they're not trying to tear you down. So get rid of the bad ones, because life is too short to have people bringing you down. And finally, peace with the world. Guess what? The world is not created to make us happy and successful. Bad things happen, as we found with that dreaded COVID word that Dr. Gelbart doesn't want to use. A lot of bad things have happened. But you have to understand that that's the nature, that there's ups and downs, and try to figure out how to not have regrets. How can you possibly succeed if you don't take chances? That's my final final statement about spirituality. Dr. Gelbart?
A few last words from me, and then we'll get to some Q&A. And even though we're talking about not being perfectionists, you know what? I want my pilots to be perfect. I want my surgeons and my doctors to be perfect. So once in a while we want that. But anyway, we won't go there today. Anyway, so again, let me sort of sum up that, as I said earlier, how you're going to feel, how you're going to be will be an intentional act. You know, I often ask people that come to see me, I say, keep a diary. First I say, tell me what your priorities in life are. And almost invariably they say, my kids, my wife, my friends, my family, you know, down somewhere near the middle to the end is my job. Then I say, okay, here's what you do. Go home, keep a diary, and write down everything you do, and come back. And a week later they come back, and generally, the people who are not very happy, their time is flipped. So the kids are their number one priority, but they spend 3.5 minutes a week with them. And again, we have to go to work there, the proverbial 40 hours, but some people do a lot more. So I ask people, take a look, make your priorities, and spend your time on what you say your priorities are. And that goes in line with you're going to wind up in the direction you're heading in. Become intentional about relationships, caring, gratitude, self-care, positive thinking, living in the present and controlling the things you can. As final two things, you can't stop the waves, but you can learn how to surf. So you can't stop life from getting to you, but you can learn how to control it. And finally, stay positive. The only difference between a good day and a bad day is your attitude. And with that, I will turn it back to Dr. Rezaeian.
Such a great and exceptional lecture and presentation. I personally enjoy every second of it, and I learn a lot. Thank you so much. And let me tell you one thing. As a community at the Torrance Memorial and South Bay, we are so lucky to have both of you here. It was amazing covering both parts of the human being, the mental and physical health. Thank you so much. Appreciate it, especially during this stressful time, call it pandemic, as you don't want to mention the name. So first of all, we have few questions. We are going over the questions and ask you. And I personally have few questions I will ask at the end if we still have some few minutes. Okay, the first question is, how do you know when your client needs more care than what you can give? So I think that question could be for both of you, because that question could go to both physical and mental needs of your client or patient. Dr. Gelbart?
So the question is, how do you know?
How do you know when your client needs more care than you can give?
Right. Well, that's a great question, actually. And, that's part of what I said earlier is, you need to be realistic. You need to be honest with yourself. And when you're feeling overstressed, overwhelmed, you need to admit it. And, the answer to that question is in many of the things that I said, which is get help, get consultation. Somebody said a client, so I'm assuming it's a professional relationship. But it's okay to say, I can't do it all. It's okay. It doesn't make you bad. It doesn't make you weak. It doesn't make you inefficient. It doesn't make you ineffective, incompetent, and so on. Because if you don't get some help and don't get some consultation and know when it's time to add, add support, then you will start turning on yourself. And we don't want that to happen. It's sort of like if you had an army, how do you know when you need help? When the opposing army is breaking through your barrier, then help build up the barrier.
Dr. Dennis? So
I've always used my emotional state as an indicator of when I need help. I lecture to physicians on burnout, and I tell them that they need to take a look at their environment, and when they think about, say, their job or certain aspects of their job, what do they feel like inside? Does that make them happy, or does it make them uncomfortable? And so I think you can use your own internal indicators to know when, in fact, you need help. Although, getting back to what Dr. Gelbart said, we almost always need help all the time. It's just at what level and what degree and who can provide that kind of help. But if it doesn't make you feel good, that's a very honest feeling, and that's something you need to respect, and that's when you start to call for help.
Thank you so much to both of you. The second question is, how do you keep a cheery attitude after 2 years of stint? So I think maybe Dr. Gelbart can answer us. How do you keep a cheery attitude after 2 years of stint?
The last 2 years, is that what it is?
Yeah.
Well, again, I think you keep it because you're still here and still thinking about that question. And as I said, I'm not suggesting you diminish your feelings or minimize them, but I am saying you need to balance the negative with the realistic. I'm not saying if it's raining out, you don't say, oh, it's a sunny day. But what we tend to do, if it's raining out, we say, oh my God, this is the worst rain I ever had. How am I going to make it? That catastrophizing. And what we need to do is not think in terms of black and white thinking, but we need to think in terms of the gray areas of our life. So instead of saying, this is the worst day I ever had, you would say, oh, it's been a bad day. It's kind of rainy, but you know what? The sun's going to come out tomorrow, the next day, or 3 days, and I can get through this, and I've gotten through this before. You know, that's, without getting too much time, that's the basis of what many of you have heard of as cognitive behavior therapy, which basically means let me deal with how I'm thinking about things, and then I can cope with that.
So after so many years in medicine, I still am tremendously energized by medicine. And I realized many years ago that the reason why I'm so energized is because I'm helping people. I believe that we are not just social animals, but we're hardwired to try to help out our tribe or to try to help out our species. And those of you that are caregivers, I think should be focusing in on how much positive you're bringing to other people's lives. I think that that's the greatest gift that you can give someone and to yourself, is to help other people. And I think that whenever I start to get down in the dumps and think, oh, poor me, then that's an opportunity to go out and try to make somebody's life a little bit better. I found one of the things that I enjoyed the most during COVID was complimenting people. It seemed like we'd given up on compliments. And so I go to the grocery store and I compliment the clerk on, thank you for being here today because it allows me to buy the groceries. Thank you to the dry cleaner for being there so that I can pick up the clothes and I can look presentable when I'm at work. We need to be sharing these sort of positive things with other people. And you know, it truly is better to give than to receive. It's a lot more fun, I find, to give than it is to get.
Absolutely. Thank you so much, Dr. Dennis. I think that is a very helpful and beneficial advice to be grateful during the adversities, especially this stressful time. The third question is, I am a caregiver for my spouse and I found myself losing physical intimacy and not emotionally connected. How do you fix the burnout? I think maybe I think both of you can answer it because it's both physical, emotional aspect of the life.
Repeat the question again, just because I was organizing my thoughts in a different way.
Yes, sure. I am a caregiver for my spouse, and I found myself losing physical intimacy and not emotionally connected. How do I fix burnout?
Well, to me, the key part of burnout is burnout happens when our expectations are not met by the reality. In the emergency department, you can't change the reality, and people were uncomfortable. And when I was teaching patient satisfaction, what I used to say to the staff was, you need to change patients' relationship with what's going on. You need to get them away from their expectations, which are unrealistic, and you need to get them grounded in the reality. So the reality is you're going to be here for 2 hours. The reality is it's going to be about 15 minutes till somebody comes in and draws some blood. The reality is I may not see you for another hour because I've got other patients. And if you give people a level set with them in terms of what the reality is, then the expectations can match up. Just a short story. Apparently, Disney is a master at this. When you're in line, you see these signs that say 30 minutes from this point. Well, Disney knows that 92% of the time, you will be there in 22 minutes. So when you get there, you say, instead of, I've been waiting 30 minutes, it's, oh my gosh, I'm here early. So that's the way you try to change that, is by setting in the reality to match the expectations.
Well, I'll add to that. Actually, I'm going to give you a very difficult answer. Sorry. I've said I'm going to add to that, and actually I'm going to give you a difficult answer. The person in that situation, what I would suggest, and again, it's not easy and may even require assistance, is open up communication. Speak to the person that you're with. And by the way, you're not telling that if you're not feeling intimate and you're not feeling good about the relationship and there's a barrier, guess what? The other person feels it too, okay? And so some people stay in denial and kind of bury those things, and they just go on, and it's sort of like building a bigger and bigger mound that's harder to get through. And what eventually needs to be done is the ability to say, here's what I'm feeling, what are you feeling? And in part two of that is, what should we do? What's the next step? How can we make this different?
I have a question here. So, what do you think about asking the expertise, like the therapists or psychologists or the primary care doctor, to give some resources here? Because I can imagine that situation very difficult for both, both side of both spouses. The person that not feeling well definitely is sick. So, and then the other person, the caregiver, feeling maybe timid or embarrassed to mention about her emotion or his or her emotion. So, how do you, recommend people to speak about something that might embarrass them in front of each other?
Well, like I said, it's a great point, and I said it would be difficult. It's quite probable and possible you'd need the help of a counselor, therapist, psychologist to help you just have this, to facilitate that kind of communication. They can help prevent you from, attacking each other, blaming each other, judging each other, and teach you how to communicate about something so painful and so difficult in a way that is positive. Because the flip side of this is, that the person in that situation has love and strong feelings and caring, and that's what's motivating them. And they need to be able to discuss that while at the same time asking to have their needs met. And as I said, if it's too difficult, then one should get some help doing that.
Can I just toss something in here? I was out at dinner a while back with a group of physicians, and we got talking about counseling and realized that all of us around the table at some point in our lives had needed counseling. Some of us had needed individual counseling, some of us had needed marriage counseling, and most of us had actually had counseling more than once. There was in that setting, it was safe to talk about. I was vulnerable, I needed help, I didn't know who to turn to, and I got some help. And so I really do encourage you not to in any way feel that there's any kind of stigma about getting help. Like I said, a bunch of physicians who were admitting to each other, I was so down and I didn't know which way to turn, and that turned me around.
And the next question is about where I can find the link of the TED Talk about the relationships.
I don't have it, the reference right now. We can put that as an addition. My understanding is that this is going to be taped and it's going to be posted, and I can add that as a resource. But it was an amazing study because it not only followed one generation, it followed multiple generations to find out what was the difference between these Harvard grads and what led them to live longer. And there is a reference, though, that I do know, which is the Blue Zones. There's a great book, and there's plenty of references online about the Blue Zones, the parts of the world where people live longer. For instance, here in California, Loma Linda, where they have the Seventh-day Adventists, and the common factors that everyone has. And like Dr. Gelbart said, relationships are key in all of those blue zones. The people who live the longest are the ones that have the best relationships with each other.
Absolutely.
I'll add one thing, since you asked about TED, not the one that Dr. Dennis mentioned, but a person who gives incredible TED Talks is Dr. Brené Brown, and speaks about relationships. Brenee, I believe is the first name, and then Brown. Just look her up on TED. She probably has much more than one TED Talk, and you'll be glad that you listened.
Thank you so much to both of you. The next question is, how do you deal with hypochondria? I think that's a very common condition in most of our patients.
Well, everyone who is a physician has gone through that hypochondriac stage. All of us in medical school realized that we had every single disease that we were studying, especially all the psychiatric ones. And so, one day it would be manic depressive, the next day it would be schizophrenic. And again, I think one thing that saves you is to realize we're all on a spectrum. We all have the basis programming. We're all genetically programmed to have virtually every disease. It's just sometimes it's such a strong expression that you get it. So one way of looking at it is, I've always felt that in a difficult situation, action is the important thing. What I used to tell the medical students, or I tell the residents, is when you're looking for somebody who's going to be a good emergency doc, you want somebody in the emergency who hears a commotion and walks towards it. And that's the way it is with hypochondriasis. You need to get some data. You're going to be paralyzed as long as you don't know whether or not you actually have that disease. You may be right. This may not be hypochondriasis. You may be spot on, but get an expert opinion. Your physician, your healthcare professional, those are the people who can be objective. I mean, that's what we're trained to do, right, Doctor?
Exactly. That's true, Doctor. And if you don't mind, I add just a comment. One of the main reason I notice in my patient that are getting hypochondriac is Googling. Please do not go to Dr. Google. Dr. Google never, ever graduated from medical school. Please do not, because when you are Googling, it's just a bunch of information, but it's not the knowledge. So there is only saying whatever happened if you have a headache and you see over there, they said brain tumor. Of course, brain tumor can cause headache, but do you have a brain tumor? You don't know. You need to ask the expert opinion from your doctor or whoever went to the medical school. Okay, so the next question is, a mom has 4 children. My sister and I do 100% of her caregiving, and the other 2 siblings do not contribute or express appreciation. How do we cope? Very important question. Dr. Gelbart?
Yeah, I'll take that. Unfortunately, that's a great comment and question. It's so common. I mean, I didn't think of it, but as soon as I heard the question, I said, almost every situation that I know, a caregiving situation, has some element of that. So somebody's much more caring for the person who needs that care than other siblings, and it's sort of not, let me divide it. Sometimes it's geographical. My sister and I live here in Southern California. My mom lives here in Torrance, and our brothers live on the East Coast. Well, there's not, that's just sort of something you have to deal with. When it gets difficult is when they're all living around here, and some just choose not to do that. And you may see this from the other answers I've given, but I'm a firm believer in nothing takes the place of communication. And so you need to sit down with the persons, your family members, and lay it out and confront what's going on. And again, if it gets too dicey, professional help does that as well. People come to therapy and counseling with family members to work those things out. And sometimes the last piece is you just have to, and I don't mean just, I hate that word, but sometimes you have to accept reality, which means this sibling and this sibling are really going to be the caretakers and the other ones just won't be there. And you have to take that as a given and make the best of it that you can.
Absolutely.
The other comment is that just because people have a behavior that isn't acceptable to you or seems like a bad behavior doesn't mean it's intentional. Sometimes people are struggling. Sometimes people are repulsed by disease or by infirmity. It reminds them maybe of something bad inside, and they avoid it. And they don't attribute necessarily bad thoughts to these things. Try to be objective and try to find out, as Dr. Gelbart said, what really is going on here.
Absolutely. And I think that starting the effective communication would be very helpful, especially sometimes people assuming that you are taking care of your parents and you're okay with that, and you are not overwhelmed. However, if you start a communication and just mention that sometimes you need some time off and you are getting overwhelmed, also let them know that how do you feel. So sometimes can solve the problem. So the next question is, I cannot leave my patient for more than 5 hours at a time. Where do you suggest that I go for some outside assistant? I think maybe Dr. Gelbart or Dr. Dennis or both of you can answer this question.
Well, I'm not. It's a little. I'm only confused by the terminology. So if a person can't leave their patient, I'm going to assume that they're a professional and taking care of somebody. Or maybe a better way to answer is, okay, there's help that you have to get. You can't do it all by yourself. I mean, if you mean you're a family member and you need some break, then you have to get sometimes help to come in the house. I mean, I don't know what else there is. You can't be, that's part of not being perfect, not thinking you need to be perfect, not having unrealistic expectations. And because, to go back to what Dr. Dennis said, this is a perfect example of you got to put your mask on yourself first. If you sit in that house and you only have 5 hours to give and you sit there for 7 and 8 and 10, day in, day out, you're going to run out of your oxygen and you'll be no good to that person anyway. So you have to get some assistance. And there are people who come and help. I don't know the situation, of course, but there's help available.
The other thing I was going to add is, without knowing what the medical situation is in terms of what kind of insurance and what kind of financial help is available, it's very difficult to know. That's why in the hospital we have social workers and people who are trained and understand what the resources are. That's really the key, is to find some way to figure out how you can get more resources. Absolutely. And because often they, like Dr. Gelbart said, often they are available, but you have no idea, and you're not going to find out by Googling it.
Absolutely. And the next question is, it is healthy to be a live-in caregiver to 6 clients in a house? I think that the person just, asking if one living caregiver can taking care of 6 patients in a house.
I don't think it's my area of expertise, but it doesn't sound healthy. It doesn't sound, I don't know what kind of situation that would be. I can't even imagine what that is unless it's a work situation where that's been your assignment. And if that's accurate, I don't think that that's a appropriate assignment of resources. Unless, again, maybe it's too much not knowing. If they're healthy people and they need a little bit of assistance, that's one thing. If they need a lot of care, taking care of one person, is a full-time job. So I don't know how to answer that.
Dr. Dennis, do you have any answer to this question?
Well, again, I'm going to kind of cop out back to the very beginning of my talk where we need to take a look at the work environment that we're in. If this is a work environment and it's an unpleasant work environment, then you need to be doing some planning about how to get out of it. There certainly is no shortage of need for people who are caregivers, professional caregivers. One of the things that has really suffered during the pandemic is home health services. And so there's just a crying need for people who are willing to do that. So I can't imagine that it would be that difficult to find something that is more positive. But again, you're exposing yourself to the risk of getting sick yourself. You can't be continually giving. You have to recharge those batteries. You have to find some way in your life of making sure that the positive is at least equal to the negative. Otherwise, as I say, you're going to get sick. In the emergency, when I would see people who were young and had pneumonia, I would tell them, okay, guess what? You just learned something. You just learned that you're trying to do too much because you're not basically unhealthy, but the reason why you got pneumonia is because you let yourself get run down. And guess what? If you get to that stage again where you're burning the candle at both ends, you're going to get sick again. So don't do it. So learn from the fact that you overdid it and you know now where your limits are.
Absolutely. And I think just it really depends that question maybe is not really giving all the information. It depends on how sick those 6 people are. But obviously, if the people sick enough that needs the caregiver, it sounds like maybe 6 people, taking care of 6 people is too much. And just returning to those slides you both mentioned, and answering those last 2 questions, I think that having a good sleep and recharging yourself is very important part of caregiver health and wellness, because if you are not doing well, definitely you cannot do good to your client or your to loved one. So I absolutely agree for both of you doctors. And so it sounds that we have no more question here. So I will take few seconds to first mention about a very important slide, Dr. Dennis, you showed about the importance of taking care of your blood pressure and cholesterol as a primary care who is also clinical lipidologist and advocate to cardiovascular prevention in my practice. I see so many people not really focusing on importance of the well-being and taking care of the blood pressure and cholesterol, and all those return back to them with the catastrophic condition like a heart attack or stroke. And we are seeing it in our practice so often, as if you agree with me, Dr. Dennis. And that's very important to do not just stay on what it is only in the recommendation, be on optimum numbers, which as you mentioned, the blood pressure is definitely better to be 110/65, and then the cholesterol, especially bad cholesterol, LDL, to be, now they are saying lower is better. If you probably heard from the European Society of Cardiology and now American College of Cardiology, lower is better. The LDL better to be lower around 70s, 65s. Even for the people with the diabetes, we want to be really lower. So thank you so much to both of you. And
I just had one comment on that. I think there's a pill phobia in our society.
Absolutely.
And people don't realize that you can't cure high blood pressure by taking the pills. And even though, so that your blood pressure comes down when you're on the pills, but there seems to be this desire to stop taking the pills. And that is extremely dangerous. And I think you kind of have to learn that the consequences of things like high blood pressure are stroke, blindness, kidney failure and dialysis, amputations as you lose limbs. And so you're doing it for a very important reason, but you have to not equate taking pills with being diseased. I'm sorry, I guess I'm diseased because I'm taking high blood pressure medication and statins. But that allows me to be able to have the opportunity to talk to you people tonight. And thank you very much for that opportunity.
Thank you so much, Dr. Dennis. Thank you so much, Dr. Gelbart. It was an honor to be here today and listen to your exceptional talks. Appreciate for both of you, and thank you so much to the audience. And I think now we can conclude our lecture today. Thank you and have a great afternoon.